The brass gears begin to turn, driving a low electric hum through the upholstered table. London, 1885. This is not pleasure, this is prescription. In clinics like this, Victorian doctors induced orgasms in female patients, labeling it essential medical treatment. This was the clinical cure for hysteria, a phantom diagnosis that silenced thousands. A physician grips the polished wood handle of an early vibrator, its metal components cold. This instrument, a marvel of new technology, is his primary tool. He calls the result a hysterical paroxysm. It is a release he must manually provoke, sometimes for hours, to restore balance to the female nervous system. But why was this strange, intimate procedure considered medicine? And what was the real sickness this machine was truly built to control? The motor stops, leaving only the sound of the clock. If you enjoy these dark histories, leave a like and subscribe and comment below where you're listening from. And now, back to the story. This was not a sudden crisis. It was a slow, clinical descent. The diagnosis of hysteria was a physician's ultimate tool of control, a label of stone pressed onto any woman deemed too anxious, too melancholy, too defiant, or simply too unwell. This phantom illness, which records suggest was diagnosed for millennia, reached its peak in the Victorian era. It was the female malady. The patient's room was not a dungeon, but a private prison of polished wood, heavy velvet, and cold porcelain. The air smelled of carbolic soap and wax. Here, a woman was renamed by her condition. She was the hysteric. Her symptoms, insomnia, shortness of breath, irritability, fluid retention, or a simple wandering womb, were recorded in neat black ink on stiff paper. Her identity was erased, replaced by the clinical diagnosis. The doctor offered a cure. It was a new, modern mercy, far removed from the brutal cures of the past, like cold water dousing or the surgical exorcisms of the medieval period. This cure was active. It was mechanical. The physician would begin the standard treatment, a manual pelvic massage. This was laborious, impersonal, and clinical. Medical journals of the time are filled with physicians complaining of hand cramps, of the sheer time it took to bring a patient to paroxysm. It was considered mundane medical labor, no different than setting a bone. The patient, constrained by corsetry and convention, endured the procedure in silence. There was no language for her experience, only the physician's clinical notes. This tedious manual works demanded a more efficient tool. The mercy of the paroxysm came with a hidden price, complete dependency on the physician. The treatment had to be repeated, weekly, sometimes daily. The patient was bound to the clinic, not by chains, but by prescription. The cure was not freedom, it was a leash. When steam-powered and later electric vibrators arrived in the 1880s, physicians celebrated. Dr. Joseph Mortimer Granville patented his percussor around 1883, a mechanical hammer designed to relieve muscle pain. It was immediately adapted. These new devices, made of steel and brass, were efficient. They were cold. They reduced the treatment time from an hour to mere minutes. The machine promised relief, but it delivered mechanical control. What sickness truly justified this strange, cold solution? The trial began the moment a woman entered the clinic. The condition was stated openly, if not in words, then in the heavy gaze of the physician. You are unstable. Your biology is a liability. The choice was binary. Accept the physician's assessment and the resulting treatment, or be labeled difficult, incurable, and risk confinement in an asylum. The refusal was rarely spoken. It was the body's insistence on its own truth. But in this medical theater, resistance was just another symptom. A patient's weeping was hysteria. A patient's silence was hysteria. A patient's intellectual argument was, according to prominent physicians of the era, a clear sign of nervous exhaustion. The cold clinical refusal line is not from a patient, but from the physician's notes. Patient exhibits continued morbid introspection. Treatment must be repeated. The diagnosis was a perfect closed loop. The only way out was to accept the cure, and the cure was permanent. This system solved the central why. Victorian medicine, obsessed with classification and order, inherited a fear thousands of years old. The Greeks called it hystera, the wandering womb. They believed the uterus was a restless, starved creature that would travel the body, pressing on the lungs, choking the throat. The Victorians, men of iron and steam, dressed this ancient myth in cold, clinical language. The womb no longer physically wandered, but it was still seen as the root of all nervous instability. They argued that civilized women, particularly the affluent, were more prone to this disorder. Their refined nervous systems were too delicate. Their vital fluids, if not expelled through childbirth or proper domestic management, would congest. This congestion, they believed, caused the phantom symptoms: paralysis, melancholy, anxiety, or fits of rage. The physician's duty was clear. He was not indulging the patient. He was releasing the pressure. The hysterical paroxysm was a hydraulic solution to a mechanical problem. It was lancing a wound. It was not sexual. It was sanitary. The theory was mechanical. The cure was industrial. But what was the true price of this cold relief? The price was the systematic erasure of a woman's voice. The escalation was subtle, moving from social pressure to physical dependency. First came the soft pressure: the husband, the family, the expectation that a good wife was a calm wife. Then came deprivation. This included the denial of intellectual pursuits, the prescription of rest cures that isolated women in darkened rooms for months, or the opposite, forced vigorous exercise. Whatever the woman's true ailment, the prescription was control. Finally, there was the silence of the machine. The physician, once forced to complain of hand cramps from the tedious manual massage, now had an industrial tool. Dr. Joseph Mortimer, Granville's electric vibrator, patented in the 1880s, was celebrated for its efficiency. The treatment, once an hour, was now 10 minutes. This efficiency inverted the cure. What was meant to liberate the patient from her symptoms now bound her to the clinic. The regular scheduled release became the new dependency. The armor of the diagnosis was complete. The patient was not healed. She was maintained. The physician's cold brass instrument was not a tool of medicine. It was a tool of compliance. The diagnosis was not a description of a disease. It was a prescription for control. But ink dries, and paper outlasts the hand that writes. The physician's clinic is gone. The upholstered tables are broken or burned. The brass vibrators, those cold instruments of relief, eventually migrated from the sterile clinic to the illicit pages of mail-order catalogs, sold as household massagers. The medical theory dissolved, but the ledgers remain. The ink lasts. In the climate-controlled silence of an archive, a researcher slides a gray, acid-free box onto a heavy oak table. Inside, brittle paper, the air thick with the smell of dried pulp and leather. This is not a physician's confident record. It is a patient's hidden truth. Archived letters from the late 19th century, written by women diagnosed as hysterics, tell a different story. They are not obsessed with a wandering womb. They write of confinement. They write of boredom. They write of husbands who controlled their finances, and physicians who dismissed their intellectual ambitions as nervous symptoms. One letter, dated 1888, describes the rest cure prescribed by a famous physician. The patient was confined to a dark room, forbidden to read, write, or even feed herself. She was force-fed rich, fatty foods to build her nervous reserves. She was not sick. She was a prisoner. This hidden evidence reveals the true diagnosis. What if the cure was just a more efficient cage? The hysteria that physicians treated with cold, vibrating metal was not a sexual disorder. It was not a physical congestion requiring a paroxysm. It was the rational response to an irrational world. It was depression. It was anxiety. It was postpartum trauma. It was intellectual starvation. It was the physical manifestation of profound systemic powerlessness. The symptoms, the shortness of breath, the fainting, the paralysis, the fits of weeping were the only language of protest available. The physicians, armed with their new technology, heard this protest and classified it as a malfunction. They did not listen to the words. They measured the pulse. They did not validate the trauma. They prescribed the machine. The cure was the ultimate act of silencing. It took the patient's desperate, physical shout for help and reduced it to a mechanical problem that could be temporarily solved in a 10-minute session. The machine was never intended to heal. It was intended to manage. It replaced the inconvenient noise of a woman's suffering with the steady, predictable hum of a motor. The cold brass instrument was not medicine, it was a gag. Did the physicians know what they were truly silencing? The ink dried. Then, the diagnosis itself was erased. By the mid-20th century, hysteria was quietly removed from the medical ledgers, a silent admission of its failure. It was too broad, too imprecise, too steeped in Stone Age theory to survive modern science. It was not disproven, it was simply abandoned. With this erasure, the official records went cold. The files documenting these cures are clinically sterile, noting only the frequency of the treatment and the date of the prescription. The patient's voice is a blank space in the margin, a symptom without a cause. The true witnesses are distant whispers, found not in medical textbooks, but in the private archives of families. They are the letters, buried for a century, describing the rest cure, the isolation, the frustration. They are not proofs of a conspiracy, they are the quiet human evidence of profound medical neglect, of a system that chose a mechanical solution over the difficult work of listening. The brass gears begin to turn. The sound is an echo now, not a hum. London, 1885, is gone, but the clinic's shadow remains. The upholstered table, the physician's cold certainty, the polished wood handle, these are museum pieces. But the hysterical paroxysm was never the true cure. It was the symptom. It was the symptom of a medicine that, when faced with the complex, inconvenient, and necessary voice of female suffering, built a machine not to heal it, but to silence it. Subscribe, hit the bell, and like. The machine is silent. The diagnosis just learned new words.